Everybody for being here today. Dennis Thrall with County Communications. We're here to unveil the Homelessness Response Action Plan. I want to thank our host today, Central City Concern. This property here is an example of the partnerships that we're talking about in this plan. It's going to be a 70-bed residential care treatment center, city, county, state, Central City Concern funded. Perfect example of what we're here to talk about today. I'll go through the order of speakers. Chair Vega Pederson, Mayor Wheeler, Mindy Stadtlander, Dr. Bruce Goldberg, Andy Mendenhall, Margaret Salazar, and we're going to come back for Q&A at that point. So we're going to ask that reporters hold questions until everyone is done speaking. And I'll come back and I'll moderate that, and we'll do the usual where, just say where you work and say your question, repeat it, pretty loudly so people can hear. With that, I want to hand off to Chair Jessica Vega Pederson. Thank you.
Thank you, Dennis. Good morning, everyone. Thank you all for being here today, especially on the Monday after Daylight Savings Time for a 9 a.m. call. So I appreciate everyone being here today. I'm Jessica Vega Pederson, the chair of Multnomah County. Homelessness is one of the most pressing, complex, and challenging issues facing our country, our state, and our community. It's heartbreaking, devastating, and all too common. A humanitarian crisis. And this is a crisis that has been decades in the making. Federal disinvestment in housing, economic instability, rising prices and inflation, persistent racial inequities in access to care and housing, too little mental health support, and the impacts of the pandemic have created a crisis of historic proportions. We see and feel this every single day on our streets. I have seen the same thing you have. A dramatic increase in human beings who don't have a safe and stable place to call home. It impacts thousands of people and every single neighborhood. I've seen examples of it in my own neighborhood of Hazelwood. Multiple RVs parked along the street or tents pitched in medians near my home. These are neighbors who have fallen on hard times and need resources. If they're in a tent, they need shelter and services. If they're living in an RV, they are one emergency away from catastrophe. Each of them needs a pathway to housing. Some of the folks living this way provide homework help to their kids on a table in an RV. They're waking up in a tent and trying to get to their doctor's appointment on time. They're trying to find recovery. They're someone's child or parent. And I know that in these moments, our system isn't working properly to address the crisis that they're in. It can't if things don't change. People don't care who's responsible for helping them, and it is up to our governments to make sure they get the help that they need. When I became chair, I knew we had to immediately begin developing a coordinated effort, one that could tackle this problem at its roots. We needed to innovate, we needed to involve providers, people with lived experience, and the many advocates who have been working on these issues for years. Today, I'm here with the mayor, my colleagues, and many of our partners to share the action plan that we've been working toward for many months. This plan reframes our efforts to address homelessness with specific measurable goals, outcomes, and data. I want to be clear, we are not starting from scratch. We are expanding on what's come before and what's worked. We are letting go of what hasn't worked, and we're moving forward. Even when certain initiatives have been successful, our response to homelessness has been scattered across jurisdictions, bureaucracies, and systems. Today, we are here to announce how we plan to make change and what you can expect to see from the city and the county in the next few years. Our shared Homelessness Response Action Plan includes 3 things I know will help us deliver. 1, bold goals and clear outcomes for the next several years. 2, a coordinated approach that makes homelessness the priority it must be across a complex system. 3, accountability and measurement of our current efforts. Key metrics to assess the work and better data collecting and tracking. We now finally have a comprehensive count of people experiencing homelessness in our community. We know many of their names. This fact alone will help us solve this challenge. We know that there were 11,153 people without a home in Multnomah County in January 2024. We know about 29% are sleeping night to night on couches, in shelters, or other temporary situations. Nearly 5,400 were sleeping outside, in vehicles, or otherwise without shelter. This baseline gives us a starting place to measure all the work before us. It also helps us set clear goals. The first of these goals, shelter or house 2,700 more people by the end of 2025. This cuts the number of people sleeping outside last January by half. One way we do this is by adding 1,000 shelter beds to our resources within 2 years. Wraparound shelters with housing and health assistance people need to move toward permanent housing more quickly. This new community sheltering strategy has been developed by Portland, Gresham, and Multnomah County and a range of shelter operators, including some of the people standing behind me. I am so excited about this partnership and these shared goals. Our plan calls for 100 of new behavioral health beds for stabilization, residential treatment, and substance use. It includes a drop-off sobering center. This work is already underway. In the past several months, we've significantly expanded our shelter capacity and invested $7 million for recovery housing and capital funding. We'll also redefine what it looks like to successfully leave a shelter by increasing the number of people who exit with a housing plan by 15%. We'll focus on the true aim of our work, keeping people in permanent housing once they get there. This is a critical indicator of stabilization for people once living on the street and working towards a better life. We'll ensure 75% of people placed in permanent supportive housing will still be there in 2 years. And yes, this will take wraparound services and supports to address the complexity of the challenges our houseless neighbors face. You'll see specific priority for some of the most vulnerable people living on our streets, especially people of color and those who identify as LGBTQIA2S+. These are people often hit the hardest and longest by homelessness and are more likely to become victims of violent crime. We have to reverse these trends as quickly as we can. In order for this work to be successful, we must address critical points in the system where we know people are becoming homeless. So in our plan, you will see a preventative focus. We will slow many of the persistent, intractable issues that lead people directly into homelessness. So what does that mean? For me, one major thing, not releasing people from our systems into homelessness. Stopping the inhumane practice of releasing people from hospital, treatment, or jail directly to the streets to fend for themselves without the resources they need. This is key. We will also work in partnership to increase the supply of affordable housing through regulatory changes, building conversions, and new construction funding. This piece, as we all know, will take all of our systems working together. City bureaus and county departments, governments like the state of Oregon and Metro, healthcare and criminal justice agencies, service providers, and business leaders. It's time for everyone with a leadership role to work together. It's time for us to connect everyone's individual efforts so that we can move forward together. You might be listening to this and thinking that this plan is ambitious. Yes, it is. It will be hard, we will make mistakes, and we will learn from them. We will keep trying and working together. I know that we cannot afford to shy away from these hard things. I'm under no illusion that this plan will solve intractable national issues, but Multnomah County, in addition to the partnership with the amazing folks who stand with me today and so many more, is committed to ensuring that the most vulnerable people in our community have the resources that they need to be safe, to be sheltered, and to be on a path to permanent housing. We have accomplished big things before, and the truth is that our community cannot wait. 11,000 people who are our neighbors don't have a home. So I feel hopeful today for the future, for the many ways these new commitments between the city and the county and our commitments to each other as community members will have the impacts on the lives of friends, family members, and neighbors. I continue to share a vision of the community you want for the people of Multnomah County and the city of Portland. We're people who have the opportunity and support to take the next steps in what their lives can become. Where our community is at the table. Where a safer, stronger community is possible because of collaboration, accountability, a commitment to equity, and structural change. Today, we are releasing our plan. Next, we build on the collaboration that went into creating this plan by asking you to help us pressure test and finalize it. This will happen through feedback and information sessions over the next few weeks. All of it will be considered as we finalize our plan. I want to thank the many people who've contributed to this work over several months, including and especially the staffs at Multnomah County and the City of Portland. Dozens of people from city and county departments and bureaus added development of this action plan to their ongoing work, and I'm grateful to every single one of them. I want to thank the providers and advocates who've contributed to and championed this effort, and who will continue to help us manifest it from here. I'm grateful for the partnership of the City of Portland and the City Council. I want to especially thank the Multnomah County Board of Commissioners, including Commissioner Stegman and Commissioners Brim Edwards, who are here with me today for standing on the side. Thank you for your thoughtful leadership. Because of these collaborations, we have a plan to meet this moment, and we are standing together to make it real. And speaking of partnerships, I welcome Mayor Ted Wheeler to the podium to talk about our next steps in our government's model and plan. Thank you, Mayor.
Thank you. Well, good morning, everyone. It's good to see everybody here. I don't think it's a surprise to anybody in this room that the homeless crisis is the #1 issue facing Portland and Portlanders. We hear it every single day through constituent emails, public meetings, conversations with business owners, surveys. We also hear it directly from our outreach staffs, first responders, our public health workers that interact directly with the most vulnerable populations in our community. I'm here this morning, of course, alongside Chair Jessica Vega Pederson and a group of dedicated experts to unveil the Homelessness Response Action Plan, a comprehensive plan that lays out goals and strategies to address homelessness across this city and beyond. Tomorrow, the Portland City Council and the Multnomah County Commission will meet together for a presentation and a discussion of the plan. From the beginning, I've been clear in my work as mayor that it was necessary for any homeless response strategy to be guided by very clear and measurable outcomes, informed by meaningful data, and address a broad range of issues facing those who are living unsheltered on our streets. I'm happy to share that for the first time, the plan provides a unified strategy that not only sets very specific, achievable goals, but also covers critical areas previously neglected, including behavioral health, a first in our response to homelessness. What distinguishes this plan are its clear, quantifiable objectives and policy goals aimed at reducing both unsheltered homelessness as well as homelessness at large. These goals are supported by precise timelines and designated agencies and partners, ensuring both accountability as well as collaboration all across the board. Moreover, this plan underscores a commitment to enhancing data systems and transparency, enabling us to monitor progress effectively, as well as to help us establish community trust for the program that we're on. It emphasizes the coordination and the linking of care systems, from shelter and behavioral health beds to housing and healthcare investments, ensuring a more complete support network for vulnerable individuals. The Homelessness Response Action Plan spans multiple levels of government, and it engages the healthcare system in an extremely meaningful way. Under the plan, it will create a new governance and accountability framework that will include a steering and oversight committee an implementation subcommittee responsible to the day-to-day operations, as well as a community advisory subcommittee to continue to give us input and feedback from the community at large. These groups will play a crucial role in setting agendas, in implementing our specific strategies, and engaging with the community to refine this program through an iterative process. It will also hold all of us collectively accountable. While this action plan is definitely comprehensive in scope, the key is not going to be the plan. The key will be in the implementation of the plan. The implementation of this plan will determine its success. We have to keep the momentum moving forward to address the crisis on our streets. The goal, as the chair said, and I want to underscore it, is to reduce unsheltered homelessness by 50% by the end of 2025. That is what Portlanders will now expect from us, and that is what we will deliver. We must meet the goals, the metrics, and the deadlines set, and also agree to review the tactics and be nimble in changing approaches if we're not seeing success. None of us can be married to any particular strategy if it is not a successful strategy. This is a leap of faith, but it's one that we're going to be taking together, and it's not just the government. We're also working with a broad swath of other partners throughout our community. I'd like to extend my gratitude to the over 24 leaders from civic, healthcare, service provider, public health, philanthropic, business, labor, and community-based organizations who've contributed countless hours to shaping this initiative, as well as members of both the Multnomah County Commission and the Portland City Council. I know you and your teams have been critical thought partners in the development of this plan as well. Finally, I'd like to thank one member of my team in particular, Skylar Brocker-Knapp. Where is Skylar? always hiding in the background. Skylar is one of my senior policy directors. She has spent hundreds of hours working on this issue and was a key member of developing this plan. I could not do the work that I do as mayor without Skylar's hard work. As we move forward in a more coordinated and effective response to homelessness in our community, I remain convinced that we can and that we will make significant, measurable progress. And this plan helps us do just that. Thank you.
Thank you so much, Mayor Wheeler and Chair Vega Pederson. My name is Mindy Stadtlander, and I'm the CEO of Healthshare of Oregon. Healthshare is the state's largest coordinated care organization, and we work with a variety of partners to administer the Oregon Health Plan to more than 460,000 people in Multnomah, Washington, and Clackamas counties. Our work is to make sure that our members get the health care and support that they need, when, where, and how they need it, regardless of their language, background, or diagnosis. And increasingly, we see that healthcare is taking on a new meaning. It's no longer relegated to what happens inside hospitals and doctors' offices, but rather touches on every aspect of a person's life. We understand, for example, that housing is healthcare, that treatment for addiction and mental health conditions is healthcare, and that when we braid all of those supports together, we can make meaningful long-term improvements, not only in people's lives, but in the overall health and vitality of our communities. We also acknowledge that there are huge gaps in our mental health and addiction system, stemming from a long history of underinvestment. That despite the best and heroic efforts of an incredibly dedicated workforce that works hard every day to provide as many services as possible, we are still critically short of treatment beds, psychiatric hospital facilities, and residential treatment facilities. But today we're standing in an example of how working together can change that. I'm so grateful for the chair and the mayor's leadership in recognizing that to be successful in responding to the needs of those that are houseless, we also need a robust behavioral health system that works in partnership. It's our job as leaders in these systems to make sure that they really work for the people that we are meant to serve. That we make sure that the right resources are available at the right time so that people don't fall through the cracks. That when someone is ready to get off fentanyl, for example, that we have treatment ready and available for them to access. And that when they're done with that treatment, they are able to get into housing that supports their recovery. But building a system like that is going to take all of us. Our health system leaders, our elected leaders, housing agencies, behavioral health providers, hospitals, and outreach workers. And I'm so grateful today to be part of the launch of this plan. This plan is a big step in that direction. Thank you.
Good morning. I'm Bruce Goldberg, a professor at the OHSU-PSU School of Public Health, and here to make a couple comments about maximizing other funding sources that's in this plan. This plan focuses on using the right dollars for the right service and calls for diversifying funding to the greatest extent possible. Doing that makes a lot of sense. It helps sustain services. It reduces competition for dollars and frees up city and county general fund and allows those dollars to instead go to other vital public programs. For example, there's opportunities to maximize Medicaid funding for supportive housing services as well as for street crisis services, such as the services provided through CHAT, Portland Street Response, and Project Respond. By maximizing Medicaid funding for street medicine, we can enhance the sustainability of these initiatives and ensure that they have broader coverage and eventually reach more people. Moreover, investing in street medicine programs can alleviate the burden on emergency rooms and hospitals by addressing healthcare issues before they escalate, thereby reducing healthcare costs and making for a more effective and efficient healthcare system for all of us. Ultimately, optimizing Medicaid funding for services for the homeless represents a compassionate and, quite frankly, a pragmatic approach to tackling health disparities and improving the well-being of vulnerable people. Likewise, the plan also calls for maximizing supported employment programs and includes several administrative opportunities to keep people with healthcare coverage and get more people the healthcare coverage that they need. Some of these projects still need scoping, but they all represent several potential opportunities to be fiscally prudent, number one. Number two, to garner additional resources, which we surely need. I think everyone can agree with that. And to maximize the diversity of funding whenever possible.
Thanks, Dr. Goldberg. I'm just going to cavil for a brief moment. 27 years ago, I was able to attend medical school classes with Dr. Goldberg, so it's an honor to follow you.
Great student.
I did all right.
Very good.
Yeah, I did. Thanks, Mr. Mayor. Thank you all. Thanks so much for being here. I'm Andy Mendenhall. I'm honored to serve as the president and CEO of Central City Concern, and we're honored to host you here in this beautiful 16th and Burnside location, the acquisition of which was made possible by partnership from county, the city, the state, key leaders who are here in the room today. We're very honored to host you here, and we're honored that Central City Concern is part of this important announcement today. As many service providers in this region can tell you, I can tell you from the heart that the release of this plan today and the resources that will be liberated and brought forward will make an incredible difference in the health, the well-being, and the resiliency of our community. This is an incredibly important milestone in the journey to end homelessness for so many people within our region. This plan will be successful in giving providers and clients alike what is needed to recover our community. I'm grateful to Chair Vega Pederson and Mayor Wheeler for their leadership in bringing together partners to work in aligned collaboration to achieve our joint mission to help end the suffering that we see around the city. Thank you for your vision, for driving to these recommendations. This plan contains the wisdom of some of our best and brightest community members and shares a set of direct recommendations on how to invest our region's financial resources in the most effective and efficient manner. These recommendations are informed by evidence and data, which include important population health data, advanced by our partners at Healthshare of Oregon. This data has been pivotal in understanding the size, scope, and scale of the groups of folks who will be served by the programs and resources today's plan will create. CCC is proud to have supported this process, and I want to acknowledge two Healthshare leaders in this work, Mindy Stadtlander and Dr. Bennington Davis. Thank you so much for your leadership in this space. The resources that are being committed today will achieve meaningful success. Our community will positively transform. This plan acknowledges the need for a diversity in the types of solutions we need, including expanding our shelter, housing, and behavioral health services and continuum. And importantly, this plan addresses the need to add these resources at scale to address the issues our community is facing today. We know what to do. We just need to do more of it, quickly and to scale. We will succeed together and ensure unsheltered and unhoused members of our community have durable pathways to services and recovery. Thank you all for being here today, and thank you for including Central City Concern in this presentation. I'm now going to pass to Margaret Salazar.
Good morning, everyone. My name is Margaret Salazar, and I'm CEO of Reach Community Development. We're one of the largest providers of affordable housing here in the Portland metro region, and I'm thrilled to be with you here this morning. I want to start today by affirming that housing is the solution to homelessness. To be clear, we affordable housing providers know well that housing first doesn't mean housing only. It means that we align housing with the right services and supports to move people inside and to keep them stably housed over the long term. Affordable housing providers are the beating heart of this community. Tonight, more than 2,700 individuals and families will go to bed in safe, stable, and affordable housing provided by Reach Community Development. And here in the Portland metro region, we are blessed to have a wide array of community-based housing providers that are housing thousands more. Today, Madam Chair, Mr. Mayor, I want to affirm that affordable housing providers are ready, willing, and able to be part of the solution to our homelessness crisis. We have answered the call time and time again to deliver affordable housing and to work with service providers to create lasting affordable housing and to keep people stably housed. We will continue to answer that call, but we can't do it alone. And that's what makes me so hopeful about this plan. It recognizes that we need to create more affordable housing and sustain affordable housing, but that we also need to bring affordable housing providers around the table to work collaboratively to help align all of these systems. With the right resources and the right alignment, affordable housing providers can be a more strategic and more impactful part of the response to homelessness. We are hopeful and eager to partner with you today, and we know the work is just beginning. There are three key areas that we hold very dear. The first, we want to applaud the city and the county for your commitment to connecting rental assistance and services dollars to our affordable housing stock, to convert existing affordable housing to permanent supportive housing. With your help, we can move quickly to fill thousands of vacant affordable units, to bring people out of the cold and to keep them stably housed, using our existing housing stock as units become vacant. Reach extends our hand to you today, and we're prepared to commit to that effort. Secondly, we can't forget about homelessness prevention. Our work doesn't end when a family moves into affordable housing. At Reach, we say that often that's when the work really begins. Today, as we recover from the COVID crisis, there are too many families residing in affordable housing that are still struggling to pay their rent. Affordable housing providers would like to work with you collaboratively to brainstorm solutions to prevent evictions and to keep people stably housed in affordable housing. The stakes are too high to allow folks to fall back into homelessness, and we want to be part of that solution to prevent evictions. And finally, we applaud the plan and we applaud the commitment of our local leaders at both the city and the county, and of course at Metro, for continuing to emphasize the production of affordable housing. Together, we've made incredible strides over recent years, opening more doors than ever before, and affordable housing providers want to be part of the solution to continue delivering more affordable housing, but also to sustain and preserve the existing affordable housing that's so important in our community. Reach and other affordable housing providers look forward to engaging with you as we roll out this plan and work on implementation. We thank you again for your leadership, and we look forward to continued partnership. Thank you. Do we have any additional? Oh, perfect. That was a nice entrance.
This is an incredibly big crowd. It's getting very full up here. So I'm Felisa Hagins. I'm the Executive Director of the Service Employees International Union, Oregon State Council. And I just want to thank everyone for, first of all, inviting me here to have a conversation about collaboration, but also about homelessness. We have intractable problems in our community right now, and it will take everybody coming together, regardless of where you lie on the political spectrum and the work that you do. I think that you can see from the diverse voices up here that when it comes to solving this problem, our whole community has to come together. It won't be one government, it won't be one solution, it won't be one person, and it won't be one entity that solves this problem. We have extreme poverty in our country, extreme poverty that we have not addressed since the late 60s. And that poverty is what is driving this problem. Homelessness is a symptom of larger problems in our community. And this plan, I think, is an example of how a diverse group of voices and a diverse group of people can come together to address those symptoms. I look forward to working with and holding the folks up here accountable to driving this plan. I think that as we come together and see how our community can solve this problem, you can see from the county commission putting forth and standing up around behavioral health issues, from the city council looking forward to building housing, from the state government and the investments we need. I'd also like to call on our federal leaders. We cannot solve this problem. Every city in America has a challenge in homelessness right now. And we currently have an election coming up. And we have 2 people running for office who have to commit to solving the problem of homelessness and housing as a basic human right, not only in Multnomah County, not only in the city of Portland, but in our country. And I know that the business community, who we've spent many months together working on this, I know that the labor community, I know that community nonprofits, and we've heard from the affordable housing providers are ready and willing to do what it takes to come together to solve this. So I look forward to working with all of you in this room as a commitment to solving the problem of homelessness and housing. So thank you. And now I think it's time for questions.
Thanks, Lisa. I'll take questions. Just reminder, say who you want to answer the question and say who you are.
Oregonian, and either Chair Vega Pederson or Mayor Wheeler. The goal to shelter or house 2,700 people. I was wondering why the shelter and housing goal is coupled together, and if that means would it be a success if you house one person and then shelter for one night the rest? Can you kind of talk about that a bit?
Stand another way.
Yeah, I saw this question earlier and I thought it was, so let me just start off with saying, we're not trying to game the system, right? The goal of having 2,700 people is to set a number that makes us and holds us accountable to what we know is happening on our street. The fact that we now have a really solid number of people who are experiencing unsheltered homelessness, and we have a good idea of many of their names, will allow us then, as we work towards this plan, the goal of housing or sheltering 2,700 more people over the next 2 years, it just gives us that visible benchmark. I will say that it isn't the only goal that we have. The numbers are really important, so that the fact that when we talk about shelter, because the ultimate goal is to get people into permanent housing, we also have the goal of increasing the positive exits from shelter into housing by 15%. So we know we want to make a difference to what people are experiencing who are living outside unsheltered. We also know that the key to that is ultimately getting them into housing. Thank you.
And if I could just buttress what the chair said, not everybody who is chronically homeless is ready for housing. There are intermediary steps that individuals need. And one of the theories behind the task sites, as well as the expansion of services at the Safe Rest Villages, was to navigate people to the services that they individually need in order to be successful in housing. And for some, it's short-term support. For others, it might be long-term behavioral health. It might be substance use disorder treatment. It might just be getting a job and retooling and having an employment opportunity. So as the chair says, the key here isn't just to move people into housing and check the box. It's to make sure that when they are ready for and are moved into housing, they stay there and they are successful and they don't return to our streets. We want this to be a one-way throughput system.
Alex.
Yeah, Alex Valencia with me. I have a question for the chair and the mayor, or both. There are a lot of similarities in this plan with the 2015 Home for Everyone plan that created the joint office, including the goal to halve homelessness or the population of unsheltered homelessness. I'm curious kind of what are the biggest differences that you see in this proposal, why folks should have faith in another similarly sounding plan this way around.
I'll go first.
You go
Okay,
first.
all right. Yeah, thank you for the question, Alex. You know, I think there's some key differences. One, you know, just the fact that we haven't had a home for everyone as a functioning group for years, and so we need to set up the governance structure. And the mayor talked about this in his remarks, that this is really key. I think one of the big differences is that we are looking at bringing everybody who's a part of the system into the table. So we've got healthcare, we've got housing development, we've got the first responders, we've got the justice system, and those agencies as a part of it. This isn't just about creating a joint office or thinking solely about the work of the joint office. It's really about bringing everyone under this umbrella. I think the second piece that is very important is the implementation subcommittee. The fact that we're going to have the practitioners, the people who are doing this work in all of those areas coming together to sit at the table to really talk about the practical things of that need to happen to make sure that we're having those goals. I think that is a really, really important piece of this. And then I think finally, you know, we are really committed to using the data, having better data, and making sure that the work that we're doing, our progress to the goals, is going to be visible, so that we're accountable to the public on this. And I think all of those things are things that are different this time. Mayor.
I, first of all, completely agree with all of that. There's an old saying that planning is everything, plans are nothing. And just to be very blunt, I believe that the parties did not fully believe everything that was in that 2015 plan. Demonstrably, when you look at the implementation of the homeless strategy, there was not a firm commitment to addressing unsheltered homelessness. It was in the plan, but it clearly wasn't a priority. If you look at the funding, if you look at the staffing, if you look at the strategies, there wasn't a clear acknowledgement that homelessness, you know, we all agree for people who are on the streets, it's a catastrophe. It's a humanitarian crisis, but there was an unwillingness, I believe, in the past to acknowledge that this catastrophe extends to the entire population of the community and that their needs are important as well. And that includes remediating unsheltered homelessness. And finally, what this has isn't just a mention of access to behavioral health or substance use disorder services. This will actually deliver those services, and it will, as Dr. Goldberg said, provide funding to be able to do it. And so I just think tangibly the opportunity to execute on this is leagues farther than where we were in 2015.
Connor Fox 12. I know Mary mentioned about implementing this plan is important to its success. We talk a lot about people who want the help, who need the help, but what about the people who deny the help or not in the mental state to accept help? Because we can't force them right now to get the services they need. Is there any mechanisms in this plan to address that, or any roadblocks at the moment from getting those people the help that they need?
So I'll stir the pot and then I'll let somebody else smooth the cream off the top. For those who are offered help and do not seek it, I have minimal patience. and perhaps a lack of empathy. We're working hard to give people a hand up so they can help themselves to get off the street and reconnect with the rest of their lives. If they say, I don't want to do it, well, then we will enforce the rules. And the rules today, as always, are that you can't just pitch a tent wherever the heck you want with indifference to the rest of the community. I feel very strongly about that. Now that's one population. You mentioned another population. That's a population of individuals who may or may not be able to discern what is in their own best self-interest. And here's where I'll stir the pot. I think it's too hard for us to be able to connect people to services who say they don't want access to services when they do. And I'll just give you one example. There's a guy who many people in this room have worked with for many, many years who wanders around downtown Portland in bare feet in the rain with a wet blanket over his head. We all know that's not healthy, it's not a good decision, and people feel compassion for that individual. But if the standards are too high for us to be able to move those people into an environment where they can be stabilized and supported and helped, then we're doing nobody a service. We're not acting compassionately, in my opinion, in that particular case. Where I think we've come together under this plan is we're providing enough connection to services, enough navigation, enough behavioral health support to get people in that door. And we shouldn't overlook the outreach component of what's being provided here as well, going out and building trust with those individuals who are on the street and helping them to understand that their life could be much, much better under different circumstances, and we want to help them get to those different circumstances.
We got time for one more.
Hello, Jessica Vega Pederson. My question is for Mayor Taylor. I know you just talked about unsanctioned camping a little bit. I know that's not why we're here, but in your initial statement, you said none of us can be married to a particular strategy if that strategy is not successful. Now, this comes just days after an Oregon Supreme Court judge declined to provide guidance on the city's unsanctioned.
You really know how to poke me, don't you?
I'm sorry, but as this comes, with that lack of judicial guidance, is that a successful strategy?
So I want to be clear. When I talk about a successful strategy, I mean one that actually helps people who are on the streets, unsheltered, to connect to services and be improved. I don't mean a judge. And I have a comment on that. So the first judge basically put a temporary, what's the word? Injunction. A temporary injunction on our time, place, and manner ordinance. And we believe, according to our attorneys, who are able individuals, that we are entitled to understand the constitutional reasoning behind that injunction. We did not receive it. And so we appealed to a higher court. And after all of that effort, they couldn't even string 2 sentences together to explain why the courts have declared this action unconstitutional. We don't believe it is. The courts, at this point so far, refuse to explain themselves. By the way, some of these individuals are elected judges, and they should be asked why they refuse to provide that guidance. Meanwhile, we're not going to give up. We have already drafted and will shortly introduce a new ordinance. It won't be as strong as the one that we wanted, but we believe it will pass constitutional muster, although small asterisks. They didn't really give us any guidance, so we don't really know.
Thanks, everybody. We're going to adjourn for now, but folks will be around after for some discussions, and we're going to be back maybe in front of all of you tomorrow at the county building for a 3-hour joint session of the county commission and the city council, where we'll be talking about this and many other things. So I want to thank everyone for coming today, and look forward to seeing everyone tomorrow. Thanks.
Thank you.